Welcome to the Vegan Gym Podcast. I'm joined by my host, Dr. Daphne Bascom, and today we are going to be utilizing Daphne's experience, as usual, to dive into the healthcare system and talk about how to navigate healthcare as a vegan. So I'm really excited for this conversation. I think that this is information that I could have really used a handful of years ago. So I look forward to discussing this with you. So,
okay.
Yeah. How do you feel about this whole topic?
I think it's important. I think navigating healthcare, even if you're not a vegan, is a challenge. But having your healthcare team understand your, not only your nutritional preferences, but what you believe in, I think is important. And it's not always something that is top of mind when you're looking for a physician.
Yeah, I think it's really important, and it's something that I know a lot of vegans struggle with.
Yes.
And I think the most primary concern that I've heard from vegans is concern around their doctors, their healthcare team not aligning with their choices,
values,
with their values, with their dietary pattern. So what would be your kind of general recommendations for how vegans can advocate for themselves and surround themselves with a team of healthcare providers who understand and are there to really help and not just not say anything negative to them as a patient, but actually really want the best for them?
So my first piece of advice is remember that you are the center of the care team. We've had a very paternalistic model where very frequently the doctor, the nurse, whoever tells you this is what you need to do and you just do it. But that paradigm has shifted, and it really needs to be shared decision making where your care team really revolves around you. So first, remember that you have power to articulate your preferences, your choices, and to be part of the decision, not necessarily to be told what to do. Second, you need to choose someone who you can actually have that relationship with. So don't always feel that you're constrained by, if you're assigned a physician through your healthcare plan, that's the only person that you have to go with. You have choices. And so if you're not developing the relationship you want, then you need to find someone with whom you can develop that relationship. And then third, you need to speak up. So people don't always ask on your intake form, what is your nutritional preferences? What are your values related to veganism? So you need to be able to share that information freely and feel comfortable doing it and not feel shamed or feeling like they're going to think differently of you, but just simply share that I follow a vegan diet. If you're not vegan, at least you may say that you're plant-based, and that if you are being prescribed procedures or medications or anything else where your ethical considerations need to be taken into consideration, then that should be a shared decision-making conversation too.
So I think that's really important to keep in mind. If someone is struggling to maintain conviction in the face of some pushback from what they would view as an authority figure, how can people best navigate that? And how can they feel more confident in kind of standing up for themselves and saying, no, this actually really matters to me? Because I think it's heavily dependent on the doctor or medical professional that you're speaking with. And I think in my personal experience, I've experienced pushback that I didn't feel comfortable navigating, or I just kind of didn't agree with what they were saying, but I didn't also at the same time feel like I had the authority or the information to really provide a valid counter argument or really be able to stand my ground beyond just saying, hey, I don't want to do that. So how do you navigate how do you kind of build that conviction, or is there a way of doing that in kind of a streamlined way that is going to, in general, be well received?
Oh, Leif, that's a good question. And that's a hard question, especially because, in particular, if it's an acute or a very scary situation, the tendency is going to be just to you internally shut down. So I have a couple thoughts on this. One, there are several places where you can actually start out with a plant-based provider. So if you're seeking care, you're not going into emergency department, you're trying to establish a relationship, you can go onto the Plantrician's website, or you can go onto PCRM's website, and they have directories of plant-based providers. So, and the same with Love Life Telehealth. There are now multiple organizations where you can initiate a relationship with multiple different types of members of the care team, physicians, nurses, registered dietitians. So these are resources that are available to you where you can find someone, GI doc, who already is plant-based, so you don't have to overcome that hurdle. If you're in an established practice or your healthcare plan has constraints around who you can see, you then need to get, I don't want to say an army of people, but you need to have someone who can help empower you to get the knowledge you need to help have that conversation. So whether it's a partner, a spouse, a friend, someone that you trust who can help you do the research. And then what you can say is, I'd like to have a conversation around this. So summary, one, you can seek out a provider who is already plant-based, going on to reputable resources such as Plantrician, Physicians Committee for Responsible Medicine, which is PCRM, Love Life, Love.life, Telehealth, which is a telehealth service for plant-based providers. Two, do your homework, meaning you can say, if you're confronted with a decision, you want to take time to assess what options are available to you, which means you need to then do homework, and not necessarily from Dr. Google, but looking at PubMed and going to reputable resources, going to Cleveland Clinic's website, Mayo Health System's website, and seeing what recommendations may be there. Third, you can always get a second opinion. There are many of the larger healthcare systems that will give you an online second opinion. They were doing this at Cleveland Clinic when I was there. You can submit your healthcare records to a team of physicians there who can also give you a second opinion. So you don't always have to feel that the first opinion you get is the only opinion. But I also always encourage anyone who is making a difficult decision, take someone else with you. One, so that you have a second set of eyes and ears, but also if that person understands your values and what is important to you, they can help empower you to proceed with a tough conversation, even when it may be very uncomfortable.
Yeah, those are all fantastic tips. So really, if you have the opportunity to find a provider that aligns with your values out of the gate, and you mentioned a few resources for how you could find that person, that is an incredibly valuable step. And that can make the entire process a lot easier after you find that person. And then if you maybe for whatever reason do not have access to someone who you feel really closely aligns with your values, being able to bring someone else who can be kind of in your corner and be on your side and help support you through that decision. And then also maybe somebody who just naturally maybe has a bit more conviction and ability to stand their ground. If that's something that maybe you've historically struggled with, then that could be really valuable as well, whether that's a spouse, partner, or a friend or family member. Exactly. I think that's a really valuable takeaway. What advice would you give to parents who are raising vegan children in terms of navigating pediatric healthcare?
There are many plant-based pediatricians. There's a growing number of plant-based pediatricians. And one resource I forgot to mention when you're looking for a provider is the American College of Lifestyle Medicine's website. So one, becoming pregnant, so conception as a vegan woman, or raising children as a vegan couple, or as a vegan single parent, is completely healthy and it can be completely supported. I think that there are now many resources that you can even take to your pediatrician. They're freely available online. I know, for example, Dr. Yami's website, you can go onto her website and she has a lot of information around how you have the conversation with your pediatrician if they're not familiar with veganism. You can also, Brenda Davis has a great resource. Her book, Nourish, talks a lot about raising from cradle to whenever the end of life is, how to feed your body, whether you're talking about planning for a pregnancy, feeding the woman while she's pregnant, and now raising that child as a healthy vegan child. It should not be an obstacle. And yes, there are still providers who may not be familiar with the safety, with the fact that you can raise a healthy child without animal products, without dairy milk. But even going on to Dotsy's website, Dotsy Bausch, she has lots of resources there that help parents feel comfortable that they are raising their children in an ethical, healthy way that's also environmentally friendly, but that you can share these resources with your pediatrician so that they too know that this is good for your child.
Why do you think that there's so much misinformation about veganism and plant-based diets within the healthcare world? It seems like I guess it's pretty pervasive everywhere in society, but I would hope that people entrusted to take care of you from a healthcare perspective would be just across the board, and I'm painting with a broad brush here, would just across the board be really willing to listen and have good bedside manner and really, really want the best for you and do that in a way that feels most comfortable to you. I guess and I've had both experiences with doctors. I would probably actually say my experience has maybe more so been a tad negative overall.
I'm sorry.
Which is a little unfortunate. So yeah, do you have any thoughts on just why that? Is it just an extension of some normal societal views toward veganism, or do you think that there's maybe some other source within the healthcare industry specifically?
I do not think, first of all, I know everyone who takes the Hippocratic Oath, any healthcare provider, is primarily focused on doing the best for their patient within the scope of what they understand. And again, there's always an overlay of our own individual values and beliefs that we bring to the table when you're taking care of people. From a nutritional perspective, and this is changing, and again, thanks to ACLM and other organizations, we don't learn about nutrition from a health perspective. We learn about nutrition from a disease perspective. So 30 years ago, I would not have had the information I have today if I was taking care of you. And there would probably be very different conversations. Now, I was a little different in that I really believe that you are part of decision-making. So if you had come to me to say, I only want to eat plants, I'd probably scratch my head a little bit, but then I go do my homework. But part of it is education. So changing how healthcare providers are educated and including plant-based nutrition and nutrition in general as part of medical education. I think that's one. Two, I do believe that everyone brings to the table their own beliefs. And I do not believe that I should allow what I believe to necessarily sway how I deal with a patient. If I was practicing, the majority of the people I'd be treating would be omnivores. And so they would be eating animal-based products. I would not judge them. I would simply, of course, I'd be subliminally messaging, you need to get that out your diet. But I would respect that, but I would try and educate, and I would try and share the health benefits of adding more plants to their plate, not in a judgmental way, but simply trying to educate and provide guidance for what may be options that maybe they weren't aware of. The American College of Lifestyle Medicine has been making a massive effort to provide educational modules, educational training to healthcare providers across the board, from federally qualified healthcare centers up to major academic medical centers, so that not only our medical students, our residents, but those who are in practice have a better foundation for what are all of the pillars of lifestyle medicine, because nutrition is just one. We need to educate healthcare providers across the board. So I think it really has been a gap in understanding the value of nutrition as a true lever that we can pull for preventing disease, managing disease, and treating disease. I also think that there is a very cogent conversation that has to be made for not making judgments based on people's values. What you believe is what you believe, and I have to respect that. Just the same as if you're treating someone who's a Jehovah's Witness and they would prefer not to receive a blood transfusion, you respect that. But you also have the conversation around, if you're in a major trauma or there's undergoing a major procedure, what are the considerations that need to be taken under those circumstances? So you need to have a broad perspective on people in the context of, how am I seeing them as a human being in the context of providing the medical care?
Yeah, very well said. I have, over the last decade, almost been conditioned to not even want to really tell your doctor. You're like, I got something I need to tell you. I'm vegan. And it's like almost something that you
say it with pride.
Don't want to. Yeah, like I think that mostly happened kind of at the beginning of my vegan journey. Yeah. And I would just be very comfortable just openly sharing that with someone who's my doctor, and I would vet them prior and ensure that is something that they're going to be, that it will be well received prior to actually engaging them to become my doctor or whatever. But yeah, it's just, I understand that challenge, and I know there are lots of people who face that. And I think it's also very much I think it can very much be a geographical thing as well. If you're in San Francisco versus North Dakota, like I think that conversation with your doctor is going to be pretty different in general. So,
but you should still feel free to bring resources into your visit with your provider. And there are so many reputable resources now related to nutrition, related to lifestyle. So education has to go both ways. Your provider may educate you, but you should have some comfort educating your healthcare team. And yes, it is scary, because when you're having a conversation with someone who you may, the white coat can be imposing, and it may make you feel uncomfortable having that conversation, but you have to advocate for yourself. If there's one thing to take away from today's conversation, you have to advocate for yourself and those you love, because what you believe matters.
Yeah, I think it can really, just make you freeze up when, especially if they will push back at all. and just say, oh, well,
Okay.
does that, yeah, why are you doing that? Or I don't know of any doctor who would just outright say, well, that's a bad idea or something, but just any kind of like, well, why are you doing that? Just any kind of line of questioning that makes you feel a little like you're on your back foot, needing to justify your beliefs or values. So what in terms of how often you should go see the doctor in terms of just kind of general checkups, I will be honest, I have not been to the doctor in many, many, many years. I think I've just had some bad experiences, and I almost rather, and I've also been moving around a little bit in the last few years, but I've just kind of, and I'm not saying this is the right focus, but my focus has been just use all the right inputs, put all the right inputs with my diet, with my exercise, with sleep, with all of that, use all the right inputs, and then I will be healthy.
Yep.
But obviously there is a time and place for getting regular checkups. So what does that look like, and what would you recommend?
I need to break this answer up into, there's going to be a conditional statement on this.
Yeah, there are lots of categories.
And part of it depends on, is your baseline health good? So you, except for your cancer diagnosis, you in general have been healthy. And, this is actually a really hard conversation. My general recommendation for men and women, and I want to put women in a little bit of a different category, because I want to make sure that they're seeing a gynecologist and having their vaginal examinations. And that needs to be done on a more regular cadence than every 5 or 10 years. So first, if you go to the CDC's website or the National Library of Medicine, there are age-based recommendations for screening tests that you should have across the life stages. And they're a little different for men and women. If you have health insurance, I'm going to put this category first, I would advise that you leverage both your physical health examination and your oral health examination on a schedule that they will reimburse. So whether that's once a year, once every 2 years, and I'm including in there your dental exam, because your dentition is also very important for your overall health. So if you are insured and your insurance provider says, we'll give you a well woman check every year, please go for that well woman check every year. Not that, it really is preventative. So my whole focus on these recommendations are preventing disease or early detection. And the same goes with men. If you are insured and you have the means, get your dental exam every 6 months and get your at least annual physical examination if that is what your health insurance plan endorses. If you are not insured, and that's many people do not have health insurance, so they're paying out of pocket, then you need to make a decision. And part of that's going to be based on, one, your current health status, and also I would say your lifestyle and your family history. So if you are at risk, if you're overweight, if you have a significant risk of cardiovascular disease in the family, if you have any factors that may make you at higher risk for developing a chronic disease, even one that's silent, like high blood pressure, I would really suggest you get in every 2 years minimum. I still would like to say at least once a year, if only for some of those screening evaluations. Let me check your waist circumference. Let me check your blood pressure, getting your labs, because we've become a less healthy population. And so a lot of the early signs of type 2 diabetes, of high blood pressure, which can lead to cardiovascular disease, if you detect them early and turn in the right direction, you can reduce your risk of developing them. And I'm not putting you in that category because you're generally healthy. So To summarize, women, you really need to be cognizant of the fact that, especially for women in childbearing years, making sure you're getting your breast exam, getting your vaginal exam, getting your routine blood work so that you can reduce your risk of any diseases that you can prevent by early surveillance. The same applies to men. At a minimum, maybe every 2 years, at least going in for a general checkup, getting your blood work done, having someone look at your eyes, your ears, palpate your belly. I really am strong about prevention and waiting. There are a lot of life circumstances that get in the way, and sometimes we can't get in. But if it's once in 5 years, if you hit that 5-year mark, then go. But if you can get it down to every year, every 2 years, that would make me feel much better.
So what am I specifically asking for? I just need a general checkup. Is that the phrase that you would use? Is that the term?
If you are scheduling your annual wellness exam, there are, based on your age, there are key things that your primary care provider will automatically know that they're going to test. They'll do maybe it's a CBC, a complete blood count, do a comprehensive metabolic panel. They'll get your height, your weight. Many physicians' offices are now doing your waist. So they'll actually measure your waist circumference. Some physicians may even do a hand grip strength. Not common, but that may be coming more frequently. So most of the screening recommendations for different decades of age or different age brackets for men and women, they are pre-programmed into the electronic health record. And so there are evidence-based recommendations for what you should get on your annual physical exam.
Okay. And what would you search on Google, or what kind of resources would you look at to just confirm that, hey, going into this, I know what my primary healthcare provider should be looking for. And then if he or she skips half of these things, I've got some questions.
What's up? If you go to, and I believe the link is on the National Library of Medicine website, they actually have, I believe it's under wellness, and they'll have it under maybe 18 to 30 and 30 to 40. So you can go on that website and they'll have a list of recommended screening examinations for that age group for a healthy population. Again, if you already have a pre-existing condition, so if you already are known to, if you have type 1 diabetes or type 2 diabetes, or you have other health conditions, you're probably already in the healthcare system. So, but don't just see your specialist. The other good reason to have a primary care doctor is to have someone who's coordinating your care. And I usually call it the captain of the ship, who is steering the boat with you on your healthcare journey. Yeah,
I'm not sure. I don't want to be critical of the healthcare industry.
Oh,
I think
it's broken.
I think my experience has just definitely been a little bit more on the negative side. And so I really don't want to speak for the healthcare industry or other people, but it has not been my experience where the doctor and I feel like a team.
Yeah.
So does that mean I just need a new doctor? Does that mean I need to have a conversation with him? What would you recommend?
I would start with having a conversation and just trying to understand if you can have a shared decision-making model. If that doesn't work, then you may need to look for a different provider.
How do I tell my doctor, who's 30 years older than me and has, at least on paper, a lot more experience than me? How do I tell him, hey, I don't really feel like you're pulling your weight, or I don't feel like this is really the relationship I'd like to have with my doctor, or I don't feel like we're a team? I think that's just a hard conversation anyway, but do you have any recommendation for kind of easing into that topic?
the time you get in a physician's office is limited. And having an opportunity to express yourself in that way. I mean, my gut tells me is take off the white coat. Just it's kind of like why pediatricians don't always wear a white coat when they go in, because they don't want to scare the children, but it can also be intimidating to adults. I would really, really say, first, just say, Doc, I really want to have a conversation with you. I want us to be on the same page, but I don't think we're there. And I need to know that we can have these conversations together and not just, I just don't want to feel that I'm being told what to do, but I want to be able to understand why, what it means, or what my options are. And I know that's a hard conversation to have. And it'll probably feel like someone's running in the room, asking all these questions, turning toward the computer to type, then they're running out the door again.
That's been my experience.
Yeah, you can leave a message on the portal, would be one way, just to say, here's some things I would like to talk about at our next visit. And so message them in advance to say, I'd like to have this conversation. Or, so one, they can be prepared and know that this is a primary topic that we need to address before I leave the room. But if the words are never said, then the conversation can never happen. I don't want people to assume that they know how you're feeling if you don't express it. So just as in any relationship, what's unsaid can sometimes put us a mile apart, as opposed to having that conversation and bringing us closer together.
That's a great recommendation. You could call the doctor's office ahead of time and just speak with the receptionist, or you could leave it in a portal if you have access to that. Mm-hmm. I guess maybe this means I need to see a doctor because I have never done the portal thing. So maybe that's ubiquitous now, and I just haven't been to the doctor, and it's just been too long. But yeah, just being able to communicate that ahead of time before you actually go in person, I've always been able to express myself better in writing, and that can also just be a lot more comfortable. You can take some time to think about it. What am I really feeling? What do I really want to chat about? And then being able to easily share that prior. And then both of you are going to meet in the exam room or wherever, and be on the same page and know that that's a conversation that needs to be had.
2 points to that. One, I always try not to have these conversations with someone in a paper gown or any type of gown. So if you're going to have a crucial conversation, and many providers do this now, they may either have it after you're dressed, because again, that dynamic of I'm sitting here half undressed having this conversation, it just does not put you in a good position. So either have the conversation before your exam, or have the conversation after you've put your street clothes on again and you're feeling more like you. Secondly, I frequently, with the many people I work with, I will help them create a list of questions so that they can rehearse. And I know that sounds funny, but if you've had the conversation in your head a couple of times, it's sometimes easier just from that motor kinetic memory to then have the conversation when you're there in real life. So have someone you trust create a list of questions for you, and then practice in the mirror and just feel comfortable going through the conversation. So just like you do your reps in the gym, do your reps before you go in to have the conversation. And then a lot of it will flow out more easily because you've said it, you've practiced it, and you're a little more comfortable with actually articulating what you want to say.
So you've shared your general recommendations for how often people should be seeing their doctor and getting a wellness checkup. For me, and I'll share kind of I guess the way that I've been thinking about it, my perspective. This is just me personally. This is not at all health advice. And I would appreciate you pushing back and just sharing your honest thoughts. I get my blood work done. And if everything looks good there, I have a blood pressure cuff. I weigh myself. I get regular body composition testing done. I know that I'm generally quite healthy. I eat a very healthful diet. I train regularly. And I don't know that I've ever had a checkup with my doctor that covered anything that I couldn't just pretty easily do at home. And I know we should caution people against just becoming their own doctor. And that's not what I'm suggesting. But if I'm already really on top of my tracking kind of the important health metrics that we've kind of covered, what is the real benefit to a wellness checkup?
I'll say that you're probably 2 standard deviations outside of the normal American population in terms of your level of self-monitoring and your diligence with your nutrition and physical activity. So for you, the elements of your health that I don't think you can assess yet independently would be your visual health, your oral health, making sure, and you can do this, a testicular examination, definitely, is there anything significant anyone would find by palpating your abdomen? Probably not, unless there's a big mass there. Doing a prostate examination, maybe. But for the most part, I would agree, given the diligence that you have with your health, you may not necessarily need to go in every year, except for those elements. You can't do your own oral health. You can't do your own eye health. Can't look in your ears, can't feel your belly, can't assess your prostate. Otherwise, not many things that you can't do on your own. And some of those may even change. But for the majority of the people who aren't getting their labs regularly, who don't move regularly, who are eating an ultra processed diet, those are the people I worry most about, because that's who their LDL is creeping up, their triglycerides are creeping up, their A1C is creeping up, their blood pressure is creeping up. So it goes back to our conversation several podcasts ago. If you're measuring and monitoring, you can manage. 100% agree. You are measuring, you're monitoring, you're managing. I still would want you to get your eyes checked, get your dental exam, and maybe go in to see a physician on some regular cadence. But you're not the norm.
Yeah, well said. And that's a very important point. That's not painting with a broad brush whatsoever. And everyone, that is not at all health advice. I was just wondering from my perspective, am I missing something? But I totally agree. The points about eye health and oral health are really important. So I do totally agree with seeing a dentist on a regular basis. Mm-hmm. I think that's a completely different conversation than your primary care physician. And then also I wear glasses. So every time I get an eye exam, they go through and do kind of a whole eye health assessment in quite a bit of detail. So yeah, I do have both of those boxes mostly checked, and a dentist is something I need to increase a little bit more of when it comes to frequency, but I do feel in control of those. And my understanding is that the prostate exams don't become
you're too young
consideration until you're 40.
Yeah.
I think it's 40. 45.
I want to say it's 40.
I'm pretty sure so 40. So that hasn't exactly been on my radar yet. And I think
testicular exam, you still should.
Just making sure that there's no like mass or no feeling. Yeah. Okay. Yeah. So I guess that's really helpful in helping people to understand the importance of seeing a doctor on a regular basis, especially if you have any kind of underlying health concerns, and especially if you have a history of maybe some challenges within your healthcare path.
If you don't feel right, though, don't delay it. Yes, because your body's telling you something. So don't put off if something changes and you don't feel like, and you're worried something's wrong, listen to your inner you.
That's a really, really important point. So beyond just doing the checkups, if there is an actual issue, don't brush that under the rug. I think so many people do that because they're afraid of going to the doctor, or it's just an inconvenience, or it's an additional expense. But if you don't have your health, you don't have anything. And if you do not prioritize your health, it is, I think that's always going to end up being more expensive in the long run, both financially and then in terms of your health as well. So to kind of wrap up, are there any specific blood tests or diagnostic screenings that you feel that vegans should really request to ensure that they are meeting their nutritional needs, that they are really healthy on a plant-based diet? What kind of general recommendations would you give to someone on a plant-based diet?
I love talking tests. For the most part, everything that you would normally get. The unique things that I would want to make sure, which aren't always part of a regular screening exam, check your vitamin B12 levels, check your vitamin D level. Magnesium, not always one that is definitely diagnostic. A1C should be a standard part of most annual wellness examinations. Those are the ones I would say it would be unique to vegans. I mean, the other ones are common across the board, but your D, B12, I can start to layer in your omegas maybe, but those are tests that aren't standard from a recommendation in terms of normal preventative healthcare.
Yeah, when I get my blood testing done, there's a vegan vegetarian deficiency panel that you can get from Quest Diagnostics. And that's one that I've gotten a few times. And I think that's maybe, they're being maybe a little stereotypical there, but I think that it is helpful. And those are some of the more common deficiencies that you might tend to see with someone on a plant-based diet. Not that they are just solely experienced by people on a plant-based diet, those are, in fact, the vast majority of people who are deficient in anything do not follow plant-based diets simply because of those numbers. But yeah, you can be incredibly healthy on a fully plant-based diet. It is still helpful to just really ensure that you are meeting your nutrition needs, because everyone has slightly different nutrition needs as well.
Correct.
And the sources of foods in our diets are different. So one plant-based diet is not necessarily going to look the same as someone else's plant-based diet. And I think it's important to track that over time.
And if you're consuming, your absorption also plays a role.
Mm-hmm.
So if you are not optimally absorbing all the nutrients that you're putting in, your serum levels still may not be reflective of that. So just knowing, do I need to add some more kale? Do I need to add some more arugula? It's again, I really feel strongly about monitoring and measuring, because then you can make intentional changes to what you're doing.
Yeah, great. So you mentioned some resources. We'll put those in the show notes or in the description on YouTube. And yeah, we are starting to film pretty much all of the episodes that we're doing for this podcast. So if you would like to check that out, you can search for the Vegan Gym Podcast on YouTube. We started a second YouTube channel and we're posting our content on there. So if you would like to watch a video version, feel free to go check that out. But you can also just continue listening to the audio only version if that's your preference. So Daphne, really appreciate your wealth of knowledge. Thank you for helping us to navigate the healthcare system. And any kind of final thoughts that you have?
Be your own advocate, and also be the advocate for those you love.
Great. All right. Well, thank you so much. Really appreciate your time. This was a really valuable conversation.
Thanks.